I'm Dr. Morris Jagodowitz. I specialize in pain management and interventional injection techniques. I deal with nerve injections as well as cosmetic procedures. Whether it be cancer pain or low back as well as neck pains, we evaluate and we determine if nerve root block procedures versus simple epidural injections would be helpful for the patient.
I'm Dr. Jacob Offenberger. I'm a board-certified allergist immunologist, and we take care of the gamut of allergic condition all the way from infancy up to geriatric patient. We specialize in treatment of asthma, whether it's a mild asthma, moderated asthma, or severe asthma. We are doing the test to see why you have the asthma or why asthma getting worse, and then we address the condition with the proper medication and the proper treatment to stabilize the asthma so you will have asthma but you won't suffer from asthma. We also take care of people that has hay fever or nasal congestion, runny nose.
Fierce Santa Ana winds are causing a spike in allergy sick visits.
Runny eyes, itchy eyes, sneezing feet, sore throat, increase in cough, a lot of people getting hives that they never had before.
Dr. Jacob Offenberger says the hot air paired with long, strong gusts are making the spring allergy season stick around.
Asthma is getting better? Yes.
32-year-old Jonathan De Leon of Valencia is so focused on his worsening allergy symptoms.
Lately it's been bad.
He thinks his asthma is under control, but today he's in for a surprise.
And then when you're ready, you're going to start to exhale. Okay, just stay in that green. Stay in the green, Jonathan. Good.
This test measures how well his airways are reacting. A reading below 25 shows asthma is under control. Anything above reveals his lungs are getting ready for an attack.
And the winning number is 80. Asthma is acting up.
Doctors say what people with asthma may not realize is that long before they have an asthma attack, their airways are inflamed.
So it's a good way, if he will take his medication, that he won't end up in the emergency room or need to get some urgent care.
To get his symptoms under control, Dr. Offenberger told Jonathan to stay indoors, drive with the windows closed, and be compliant with his asthma meds. And at home, he should shower and rinse out his sinuses.
You definitely would like to do it before you go to sleep, because you don't want to sleep on a pillow full of pollen from all the stuff that got stuck on your hair during the time you spend outdoor.
Jonathan's grateful he's been spared a serious attack.
I need to start taking more medicine and I guess control my asthma better.
Dr. Offenberger says people with high blood pressure should avoid over-the-counter meds that contain decongestants. Also, remember, allergy symptoms can flare up year-round, so it's important to find out what you're allergic to and have a treatment plan.
When a patient is first evaluated for a pain condition, we take an extensive history. We do an extensive examination. We evaluate any X-ray or MRI findings for that particular patient. If this is an acute situation, we place the patient on anti-inflammatory agents as well as muscle relaxants. In most cases, back and neck problems that are acute resolve by themselves within a month. If the problem persists, we then have to get an MRI or any other studies that we need in order to determine if there's been any damage to the spine itself.
So when a patient is get referred to us, we listen to the history to try to get clue of what can cause it. We do a physical exam. We are going to identify the target organ that are involved in this condition. Sometimes patients come to us, complain about runny nose, and we find on the physical exam that they have asthma. Sometimes they come to us for the asthma, and we find that they have also suffered from nasal allergy. What we perform in the office is a battery of allergy skin tests that is able to pinpoint the cause of your allergy, whether it's a tree pollen, a weed pollen, grass pollen, your cat, your dog. All of this is able to get an answer in 20 minutes after we put the skin test on your arm. For patients that develop severe skin rashes after using all kinds of shampoo, hair product, lotion, detergent, we have a special test called patch test that can identify the chemical that cause them to have allergic reaction, and by avoiding that chemical they will not get anymore this annoying skin reaction. We have an E&O machine. It's a unique type of machine that can measure the allergic inflammation of asthma. By that allow us to make the correct diagnosis of asthma and to adjust medication in the right dose. In allergic asthma, a certain type of cell in the lung called eosinophil, upon exposed to allergic stimuli, release this gas called nitrous oxide. And we have a way to measure it. So the higher the level of exhale nitrous oxide, the more severity is the asthma that you have. For certain patients, we also perform pulmonary function tests. For people who like to dive and need a clearance for diving when they have asthma, we do the pulmonary function test in the office and tell them if they should go on vacation and dive or they should take care of the asthma, and then they are able to enjoy vacation without seeing a doctor while on vacation. One of the issues that I see in our office frequently is people that want to know the status of their food allergy, especially peanut allergy. So we have a special test, what we call You-Know test, that can tell you if the peanut is a life-threatening type of a peanut allergy or non-life-threatening peanut allergy. And then we make a decision if we need to give you an EpiPen or not to give you an EpiPen. So a lot of patients found that they have peanut sensitization but not peanut allergy, and they can stop buying an EpiPen every year. We also one of the few offices that has an access to the ISIC test, which is a unique test to look for unexplained allergic reaction that patient has when all other tests will all come back normal. It's a very unique new test that is available in our office.
Here we have the lower back. This is your spinal cord with your discs. This is the front. This is the part we can't see. This is the back. These are the bones that you feel in the back of your back. Notice we typically have spacers, and these are called your discs. These are your lumbar discs. They're evenly spaced and allow the nerves that are running into your legs, they're freely movable, they're untouched. If you develop a herniation of your disc or a compression, it usually pushes on one or both of the nerves. The disc itself compresses and bulges on one side or the other. If we take a look now at individual segments, the first one we have here is simply a normal one. As you notice, the nerve roots going into the legs are free. Notice what happens when you have a disc compression. Notice that it pushes on the nerve root going down to the leg. When we do an epidural injection, we will go in under fluoroscopy and we will inject the cortisone into the area, which basically flushes the area with a steroid-type solution, which will decrease the swelling. When we do a nerve root block, we're more specific. Instead of going into the middle space, we go off to the side where the actual nerve root is, and we inject the medication as the nerve root exits the epidural space. If you're having low back pain with very minimal leg pains, most people can get by with a simple epidural that works quite well. If your pain is specific for one leg, left or right, and is associated also with some numbness, we typically recommend a nerve root block. This will go after the cause of what's causing the compression and the swelling in that area. These procedures are done under fluoroscopy. Fluoroscopy is a procedure where we use an X-ray that moves, allows us to determine where our entry point is. And we're able to see where we are injecting, and we're able to see where the flow of the medication, whether it be cortisone or a local anesthetic, lidocaine, is going. We do these procedures at a surgery center, outpatient, and we provide anesthesia so there is no discomfort to the patient during the procedure. We now move to a different category of pain control, and that's called spinal cord stimulation. The spinal cord stimulation device we use is a precision device from Boston Scientific. Basically, electrodes are placed, say, in the lumbar area at the L1, L2. Two electrodes are passed under fluoroscopic guidance, followed by stimulation from a little device that eventually, if the device works properly, is implanted in the buttock. This allows the person to be relatively pain-free and not require any narcotic pain medication. In order to accelerate healing from damaged tissues, as well as possibly regenerate areas like knee cartilage, we have two new procedures that we perform. One is called platelet-rich plasma, where we take an amount of blood from an individual, we spin it down till it's rich in platelets, and then we inject it, whether it be into the shoulder, the knee, or the hip joint. What this is shown to do is accelerate the healing. So whereas it might take 6 months for an area to heal, the area might heal quicker using the platelet-rich plasma. We remove stem cells from the hip bone, which is known as the posterior iliac crest area. And then we take these stem cells and we inject it into the knee, the hip, or the shoulder joint. Studies have shown that in most cases, there's been approximately 80% improvement in the regenerative process in these joint areas.
Once we identified the culprit for your allergy, we can give you or certain medication to control it, or to tell you what you have to avoid, or in case you cannot avoid it, then you can go on allergy shot that take care of the allergies that you have. We also incorporate to our practice the new allergy tablet for grass and ragweed that you can do at home without the necessity to come to the office weekly for allergy shot. We provide care for patients with severe asthma with a new modality of treatment called Xolair. The result of this treatment allows patients with severe asthma to use less medication, to feel much better, and some of the patients are able to stop completely all kinds of asthma medication. The new modality of treatment is addressing the cause of the allergic reaction, or what we call the marker for allergy in the blood, called IgE. And Xolair binds to that molecule in the body and remove it from the immune system. And if you have less of the IgE in your body, you will have less and less symptom of allergy. We are specialized in taking care of people that has chronic infection, sinus infection, ear infection, throat infection. We identified the cause for that immune problem, and while we identified the condition as what we call common variable immune deficiency, we are able to treat this patient in our office and give him an infusion of gamma globulin, the part that their own body is not producing. It's very happy for me to take care of the patient, because first, allergy is a condition that if you address it, people feel much better. It's a very common condition that a lot of people suffer, and many people learn not to take care of it. And once you address the cause of the allergy, you treat it, and patients are very, very happy.
In terms of cosmetic procedures, we deal with precision injection techniques, whether it be injection of Botox cosmetically or for pain. We use a variety of fillers for the face, which decreases aging by about 10 to 15 years. We have a wide variety of lasers. The lasers are typically used for brown spots, hair removal, laser vein removal. In terms of relaxing muscles and getting rid of wrinkles, we typically use either Botox, botulinum toxin A, or Xeomin, which is also botulinum toxin A. Both of these products work very efficiently. Both of these products work very similar. Typically, it takes 7 to 11 days before one sees the results from a botulinum toxin type A injection. Fillers are used to fill spaces, whether they be the nasolabial folds of the face or they be the marionette lines, which we see down here in the corners. We use a wide variety of fillers. The typical filler we use is a product called Radius. This is a thicker filler. It is a calcium product whereby calcium fine granules are injected deep into the tissue areas and are eventually tissue forms around them, which makes these fillers last for approximately 1 year. We also use finer filling materials such as Voltaren and Juvederm. These are a finer collagen product, and this collagen product is used to fill in small lines above the lips, around the lips, or in the tiny little areas to fill in wrinkles. Our office uses a variety of lasers. We commonly use the Cutera laser, which can be used for individuals of dark skin or very fair skin. The lasers we use are for laser genesis, which decreases the common blemishes, rosacea, red spots, small brown spots that you see around the face and the neck. This treatment is not painful. It takes about 15-20 minutes to perform, and the results are phenomenal. Typical large brown spots around the face, on the hands or on the chest, are removed using a laser procedure known as Limelight. Limelight is a photosensitive IPL. An IPL means a photosensitive light that is adjusted for the wavelengths color of brown. So this typically will only go after brown areas and will leave the rest of the skin untouched. Limelight is fast, relatively painless, and the results are phenomenal. We have a special laser that's designed for either red lines or blue lines. So depending upon whether you have red spots or if you have blue spider veins, the laser will go only after those particular areas directly. For laser hair removal, we use the Cutera, the ProWave 770. This is a relatively large IPL handle, so it can cover large areas of hair very rapidly. We typically apply a numbing cream to the area 1/2 hour before the procedure. Subsequently, the actual procedure takes about 15 minutes. Most laser treatment for hair removal take approximately 3 treatments due to the various stages of growth of the hair follicle. In most cases, 95% of the hair can be removed. We remove hair from the face, we remove hair from the back, as well as any other parts of the body where there may be excessive hair. We use a product known as the Cutera Titan. This procedure is able to inject large amounts of heat underneath the skin without burning the skin, tightening the skin in the dermal layers, as well as stimulating the body to produce collagen. So it has a double effect. Initially, you have a tightening of the skin around the face and the neck, followed by subsequent, over the months, collagen is produced, which also helps decrease the amount of wrinkling and sagging skin. We have a very extensive drug addiction, drug dependency program. When a patient comes to see us with an addiction problem, we first take a history to determine the length of time that they've been on narcotics, the reason why they've been on narcotics. This is followed by an exam. We, of course, evaluate the patient to see if they use any IV narcotic drugs, the behavioral status of the patient, as well as their vital signs. It is our goal not only to take the individual off of all narcotics, but to reduce the craving and to provide them with new outlets in terms of controlling their problems. Many of our patients have an underlying depression or attention deficit disorder. As a pain management specialist, we use a variety of narcotic medications. Over time, individuals become addicted to narcotics, as well as individuals sometimes start at a younger age using narcotics for recreational purposes. Just as one puts individuals on narcotics for control of pain, when the time comes, you need to be able to take these individuals off of narcotics. People who develop addictive behavior and problems with the use of narcotics develop symptoms on withdrawals, whether they be nausea, vomiting, diarrhea, severe anxiety, muscle cramps, sweats, and some even have seizures as a result of it. We have a program designed for drug dependency and drug addiction, which uses an outpatient medication known as Suboxone. Suboxone is a narcotic agonist, which means it works like a narcotic, and it's an antagonist, meaning it works against narcotics. The drug has no euphoric effect, such as Norco or other narcotics might have. At the same time, what it does is it blocks these withdrawal symptoms. So our purpose, once we place someone on Suboxone, is we gradually decrease the Suboxone until we can actually get the individual to come off of this medication as well as anything else they're taking.
Suboxone, buprenorphine, and naloxone sublingual film C3 administration instructions. Suboxone film is a combination of buprenorphine and naloxone indicated for maintenance treatment of opioid dependence. It is a sublingual medication, which means that it is absorbed through the veins under the tongue. Before taking Suboxone film, drink some water to moisten your mouth. This will help Suboxone films dissolve more easily. To open your medication package, fold along the dotted line and tear down at the slit, or use scissors to cut along the arrow. Making sure your hands are dry, use 2 fingers, grasp the outside edge of the Suboxone film, and remove it from the package. If your dose is 1 Suboxone film, place it on the underside of your tongue on the right or left side and hold it in place until it sticks firmly. If you are directed to use 2 Suboxone films, place the other Suboxone film on the underside of your tongue on the opposite side and hold in place until it sticks firmly. Try to avoid having the Suboxone films touch as much as possible. Keep the Suboxone films in place until they are completely dissolved. If you are directed to use a third Suboxone film, place it on the underside of your tongue on either side after the first two have dissolved, and hold it in place until it sticks firmly. While Suboxone films are dissolving, don't chew, swallow, or drink water because they will not work as well. Make sure your friends and family are aware that you shouldn't talk when the Suboxone films are dissolving because this can interfere with how it is absorbed. Always take Suboxone film exactly as prescribed by your doctor. Indication: Suboxone, buprenorphine, and naloxone sublingual film C3 is a prescription medicine used for maintenance treatment of opioid dependence as part of a complete treatment plan to include counseling and behavioral therapy.